See your slides
At the
on. Please go
outset,
ahead.
I would like to thank Dr. Ramamurthy ma'am for giving me this opportunity. I would be speaking on the topic that doctors are capable of managing their own practice. A doctor indeed needs to wear many hats, including that of a clinician, an academician, a manager, a CEO, a financial expert, a family provider, and a self caretaker. Now, is it really possible for one single person to do all of this? Yes, it is, and let's see how. The essentials for a doctor to be capable of managing their own work are to have a visionary leadership, to have great people around, good clinical systems, and good marketing systems. The foundation of visionary leadership has to be laid down by the doctor himself, as it's only the doctor who can answer what difference would his practice make to the community around him or to the world. What is the finished business going to look like 10 or 20 years from the day he sets up? What type of employees would he want to work in his practice? What is the end game of the practice? And what is it that he personally wants to benefit from the practice? How much money would the doctor need to earn to live the life that he wants to live 5 or 10 years from now? What would the family life of the doctor be 5 or 10 years from starting? And how would the doctor want the practice to change his or her life financially, emotionally, spiritually, and physically? In today's practice, patients do not come just for treatment, they come to the practice for a feeling. What feeling are you going to leave them with is the doctor's central question, a part of the vision creation process. This central question can be answered and created only by the doctor and not by a management person. Because the essence of being a doctor, of working in a hospital, the hospital environment, the patient expectation, and the value generation for patients, these are byproducts of the years of slog embedded in the conscious of a doctor as a natural phenomenon. So, what feeling are you going to create for the patient, and what value can you generate for the patient? Value has always been defined as the amount of time a professional spent on an assignment. So, in a hospital, a doctor is central to this value creation. Value you create, the more trust you build. The next important step is to ensure having great people around. In reality, this too is a doctor's top job. Because what kind of fellow doctors you want, your juniors, your subordinates, a doctor very well understands the exact requirement, the judgment of the skill, the expertise, the operating skills required, and the higher degrees of education they're looking for. Even the final interview and the selection is done by the doctor himself. Getting together empathetic staff, again, is the responsibility of the doctor. Making sure you get people together who are empathetic, because lessons of empathy are learned in med schools and not in management schools. Next is the need for a good system, because to communicate your vision, you need to have a good system in place. For establishing a good system, very important these days are having ophthalmology practice management software and electronic medical records. Apart from innumerable other advantages, they reduce the need on managers and improve cost effectiveness, as an appropriate PMS and EMR can increase your operational efficiency, provide end-to-end solutions. They are cloud-based and artificial intelligence powered, so you can create your own practice guidelines by using them. With resource optimization, you can integrate with your POS systems for your opticals and pharmacy counter, automate your workflow with them, involve them in the billing, invoicing, e-prescribing, even integrate your laboratory radiology, integrate with the TPAs, share prescriptions via SMS, provide flexible queue management, access the system from any device and even from multiple devices, and even access all this on the go using the mobile-friendly apps. You can even track and manage your inventory. There is also patient engagement software that is provided. It can improve your communication, promote doctor-patient relationship, and what more, they also follow NABH standards and guidelines. Another very important point is the scalability. The same one software can grow along with your practice, in sharp contrast to managers whose number has to be increased as your practice grows. The glimpses of the tech revolution can be seen across all economies, not just medicine practice, as per this latest McKinsey report, which says that we are in the midst of a job revolution due to industry change and rapid evolution of technology. Exponential technologies like artificial intelligence, robotics, and automation are predicted to replace many jobs. As many as 15 to 30% of the jobs could be replaced by 2030. We are in the midst of a gig economy indeed, where traditional full-time employment is becoming less of the go-to standard both for the employers and the employees. The next essential tool for a doctor to manage their own practice is great management, which involves building the brand you. which is completely dependent on the doctor's own image, value, mission, and vision. Which brings us to the word of mouth marketing, which revolves completely around the doctor, and it has the power to transform your patient into brand ambassadors. It is powerful, cost effective, long term, fulfilling both for the doctor and the patient, and most importantly, it is independent of managers. The doctor is the center point, as reiterated by Malcolm Gladwell in his famous book, Link, where he said that most people who claim medical malpractice and institute legal proceedings do so because the doctor did not spend a lot of time speaking with them. So the word of mouth marketing, no form of so-called marketing can happen without personal involvement of and personal interaction with the doctor. No marketing strategy beats this. Patients as goodwill ambassadors or super fans, and also called micro influencers these days, are the ones who get you more referrals and more introductions. Coming to the patient's perspective, till the time bonding doesn't happen, medicine doesn't work. Even if the digital marketing team gets you around 5,000 online followers, but does that always translate into trust, worship, and revenue? Again, the onus is on the doctor. The marketing team might succeed in increasing your footfall, but does that translate into surgery? And what kind of revenue? Again, the onus is on the doctor. So it's the brand you for which the patient is willing to travel across the city rather than the nearby doctor for the brand you and the bonding that you create. It is especially important these COVID-19 pandemic times that we have seen in the form of patient education videos. Patients want to hear the doctor's words from the doctor's mouth, and that too in the regional language. So doctors have been on top of digital patient education, which is a very acceptable, covert and subtle type of marketing and has a very huge impact. So doctors in the form of YouTube videos, Facebook Live, Instagram Live, Quora, interacting with the patients. Everywhere patients want to see and hear and interact with the doctors themselves and not a manager. And it's only the doctors who can provide the appropriate content, create the appropriate content, and customize the content as per the micro market. So marketing may be left to the team, but personal branding is all on the doctor. When you brand yourself, you create your own set of communication before others can brand you. You're responsible for what you portray. You cannot outsource it across. When you are your own direct source of communication, chances of miscommunication are very less. So it is very important to leverage on this fact. Personal touch, familiarity with the doctor even helps to retain clients, patients that have already had confidence in us. That brings us to cause marketing. COVID-19 pandemic saw a surge in cause marketing with many videos, etc., on COVID-19 mucormycosis being sent out by the doctors. Sales happen in healthcare not by sales messages, but by non-sales messages. A doctor cannot promote himself or herself, but can educate. That way, establish authority and leadership. It's a non-commercial nature, which attracts more attention and earns trust. And it is associated with a cause that elevates one's personality and can represent the specialty of the expertise. So how well can an ophthalmologist manage? As far as ophthalmologists are concerned, we are mostly into daycare centers with better defined working hours and most of the time elective planned surgeries. Hence, doctors can delegate their own time and energy better towards managing other aspects. Also, lesser support staff is needed as compared to other multi-specialties, so much lesser human resource management issues. It has more so been seen in the COVID-19 pandemic times, where economically it has not been viable for everybody to have managers. Self-reliance has become the new normal. Also, with the upcoming telemedicine, telemedicine has further reduced the need for managers. Necessity, the mother of invention. Telemedicine has been around for a while, but it took a pandemic to bring it to light. So to conclude, is it possible for doctors to carry on the management on their own along with the work-life balance? Yes. If you can clarify your vision, exploit your strengths, structure your workload, preserve your energy, create a good system, it's very much possible. Thank you.